So thank you, everyone, for joining us today. Thank you so much, Dr. Barker, for doing this very useful presentation for us. It's like the right time to basically have something like that. We really appreciate it. And I'll just leave it for you.
Okay, well, thank you very much for the opportunity to be able to speak to you and your families. I want to start by saying how much work has gone into ensuring the safety of our families, the students and teachers. And I think that it would be really important for us to provide you with as much support in terms of answering your questions and assuring you of what appears to be a very safe environment right now. And we really know that the value of an education for our children and youth is so important that we really want to make sure that we encourage you to send your children back to school. I do also want to say that it would be unrealistic for us going into the fall not to expect that we will have a case in our schools. But the work that we've done over the course of the summer really does suggest that even if we have a case, we are well prepared and will be able to contain that to the extent possible. And so we don't plan on closing schools unless it became obvious that the school could no longer function. But at this point, we're managing to assume that if we have a case, school will continue. What I do want to say is a big thank you to Anne Hogan, who is our public health nurse on the phone today. She works very closely with the schools, and she's going to provide a presentation to set the tone for what we're expecting next week when all the families go back to school.
Thanks, Dr. Barker. In the past couple of weeks, we've been doing presentations for multiple staff members within the school district. So people like the custodians, the maintenance people, all the support workers, like the people that are on the child and youth team, so speech language pathologists, guidance counselors, all those different people. So we're making sure that all of those people are aware of the return to school information. So this is the time for parents and public. So I just want to say that this presentation is also posted as a PowerPoint on the Anglophone South School District website as well, so people can see it there too. So welcome, it's exciting to start another school year, and just want to remind people that, you know, there are some changes, but there's lots of things that have stayed the same. And I think that's really important for you to be aware of, and for you to remind your child when you're sending them off to school that, you know, there's lots of things that are going to be familiar at school if they've already been to that school before. And, you know, be excited for them that they're getting the opportunity to go back to school and see some of their teachers that they know and their friends and all those things. And that, you know, there really are just a few changes that are going to happen. And that at school, the principal and their teacher will make sure that they know exactly where to go and what to do. And so they shouldn't be nervous about going back to school or anxious, because the schools are well prepared. We've actually done a tour of a few of the schools as they asked us to come in to see about their plans. So that was exciting to do that. And I know the schools and the teachers are all excited to welcome the students back to school. Oops. Let's see. There we go. So as mentioned, you know, it's been a lot of work with the Department of Education. So the Department of Education and Early Childhood Development within the province, and through our own school district and our public health nurses and Dr. Barker have worked together to develop all the guidelines that are available now. So there's been some revisions already, and we expect that there'll be more. So we call them living documents. So that means that, you know, they're always up for change, and it's always dependent on what's happening within our community. And so Anglophone South is a big school district. It covers Sussex to St. Stephen, into Graham and Ann, Deer Island, Campobello. So you know, if we had a case in a school in St. Stephen, that wouldn't necessarily affect schools in St. John or Sussex. So it's important to keep those things in mind as well. So, you know, we really want to have a safe and healthy learning environment in our schools, and we all have to be ready for change, and that's part of our role in public health to guide people around those changes. So just the guiding principles for schools is, you know, the Department of Education is there to provide public schools and learning environment for students, and that's essential. So unlike the spring when the schools closed on March the 13th and didn't go back, there was some learning offered, but it wasn't necessarily mandatory, or it was a little different depending on what teacher it was and what grade they were in. But this fall, it's more standardized, and whether the children are at school or whether maybe they need to be home because there is a case in their class, and there's a need for self-isolation or for some other reason, then the learning will continue there. And they will be receiving marks and home reports and all those things that they would have even if they were at school. And we'll talk a little bit more about that, what it looks like in each grade level. Each school has an operational plan. So all of the principals were given a template, so an example of a plan, and then they took that and made it unique to their school. So we know that all our schools are different sizes, and they're in different communities and have different things available to them. Some schools have, you know, multiple playgrounds or multiple fields they can use for spacing outside, and some have smaller areas, and they're all very imaginative. And we actually reviewed all those plans last week, and so they're back with the principals now. They were well done, and today they're presenting to their teachers. And the rest of the week, they'll be covering it with some of their other regular staff. And so I imagine the staff will have some questions, and if something needs to be changed in the plan, then they'll be able to do that. And they'll also be posted on the school website on Thursday, September 3rd. So anybody that wants to see what's happening at your own school can go on and look through that operational plan. So just a little bit about what is COVID-19.
Just a quick question, Anne, if you don't mind. So like so each school has a different, like, okay, there is a template that you guys created, and then each school would have their own, they tailored it according to their own needs and I guess the size and all that. So what does that mean? Like, could there be a better plan and X than school-wide, or?
No, it's more based on, you know, how can different class bubbles, so within the bubble itself, they wouldn't have to physical distance, but when they're outside in hallways or outside in the playground, they would maybe do different things to keep that physical distance. So there's a lot of common things within the plans. I would say more it's around a little bit of maybe when they have their recess time or their break time, their lunch time, how that happens, if cafeterias are open or not, where students can go in the playground at certain times and how that happens. But the majority of them are very similar. So most of the elementary schools, you know, have a common things in them, but might be just a little bit different, or where you sign in at the school, that kind of thing.
How about like for high school, where they can go, they have usually a whole hour for lunch. Are they gonna still get this whole hour? Like they're gonna just, you know, have like you have two high schools in uptown.
Yeah.
It's a huge population all of a sudden during lunch hour.
Yes, they'll still have their lunch hours, depending on what their schedule has been in the past. So those things will stay the same. And obviously the students are going to be encouraged to, you know, wear masks when they can't keep the physical distance outside of the classroom of 2 meters. Within the high school, the classroom, it's 1 meter. So we'll cover that a little bit later too.
Okay, thanks.
So just back to why it's called COVID-19. Sometimes we hear it referred to as different thing, the coronavirus, the SARS-CoV-2. So typically in most places you see it as COVID-19. So the CO in COVID stands for corona, which is a Latin word for crown. And there, if you looked at the virus under the microscope, you would see little crown-like things on the virus. So that's where they get that from. The VI is for the virus, the D for disease, and the 19 is for the year that it was discovered in 2019. So we know that it was discovered in December. So it isn't, why is it different than other coronaviruses? Because coronavirus is the same virus that causes the common cold. Or maybe some people might remember the SARS virus back in the early 2000s, and we had cases of that in Toronto area. So it comes from the same family, but this is a different. So people don't have any natural immunity to it because it hasn't been around. There's no vaccine. There's no vaccine yet. So we don't have the benefit of having that built up immunity. So how does it spread? It spreads like other viruses that are spread by respiratory. So if we sneeze or cough or speak loud and you spit when you cough or when you speak. So you can see in the picture on the left that that person has coughed or sneezed and the little viruses are in the air. And the droplets are fairly heavy, so it doesn't typically stay in the air very long. The droplets fall down to surfaces, so they can live on surfaces a little while and on our skin for about 15 minutes. But we know we have the habit, many people do, of once we unintentionally take our hands and put them to our nose or face, we have an itchy eye, or, there's something on our mouth, so we rub that. So it's important to remember that's how it's spread. That's how we get into our body. Or someone being close to us and they sneeze or cough and spread those germs. And that's why the 2 meter difference. So there are some myths out there. There's lots more myths than these ones, but these are just a couple that we picked out that were kind of either funny or interesting. For mosquitoes, COVID-19 is not spread by mosquitoes. It's not spread through blood. Not spread through, internet networks or anything like that. What about shoes or anything like that? If there was a high amount of the virus somewhere, potentially it could get on your shoes and that could spread on the floor, and it would be highly unlikely that someone would get it from shoes. But that's why we encourage healthcare providers that work in hospital that if they're, to change their clothes before they leave the hospital for that precaution. So remember, the main way it's spread is through respiratory droplets. So that's through coughing or sneezing, singing, those kinds of things. So just to take time back a little bit, back in March, we heard a lot about flattening the curve, and what does that mean? So we know that back in March was the time that we brought kind of what we say the hammer down. So we shut almost everything down for a restart, so we could get a feel of what the virus does, how it was spread, what we can do to prevent that. And it worked well in New Brunswick, but we want to go on with life. Nothing has changed with the virus. We don't have a vaccine for it. We don't have really a treatment. We can treat some symptoms, but we don't really have a good treatment for the virus itself. So we need to learn to live with the virus. So that's what we've been doing pretty much since, later in May and into June. So we've learned to, they call it the dance. So learning to live with the virus, or balancing the risk of the virus and what can we do for protective measures. So that's what we're going to talk about. What protective measures can we do while we are, waiting for a vaccine? That could still take a couple of years to get that and for everyone to have it. And then we need to know how effective that vaccine is. Do people have immunity and all those? So it's really important for people to get the regular vaccines through immunization to protect ourselves from other bacteria and viruses. But for right now, COVID-19 doesn't have a vaccine. So some of the things.
Sorry, Anne. Do you then recommend like people still get the flu?
Definitely.
Every year when we do that?
Yeah.
Yeah, okay.
Definitely. And that should be out in mid to late October here in New Brunswick.
Okay, but it's not going to be mandatory or anything at schools, like just like every year, just
right. Yeah, but we'll certainly, the difference this year is that it's offered for free for everyone. Before there was certain criteria that people would have, like over 65 years old if people had a chronic disease. So, but now it's free for everyone.
Is it offered at schools by any chance or no? Just through doctors' offices?
I'm not sure what Dr. Barker might be able to comment on if she's heard of any plans of getting it out there. I'm not sure yet. We have other immunization clinics at school, but I'm not sure what will happen with
And the only reason I'm asking because we do have some clients that they do not have family doctors yet. So
right. So you can get it at local pharmacies as well.
Oh, okay.
Yeah.
But you're absolutely right. There's a lot of talk around how we can reach as many people as possible for the influenza vaccine this year. And as we say, anyone over the age of 6 months is eligible. And we all know how similar the symptoms are between COVID-19 and influenza. So if we can try and get our vaccine rates up, then that would be helpful for us not to be confused when we've got influenza and COVID circulating.
So for that, when in the fall, when people do get tested for COVID-19, they'll also be tested for influenza A and B and for respiratory syncytial virus, which is referred to as RSV. So that will be a benefit to us to see what's causing the symptoms in the person. So some of the things that we can do to help to decrease our risk, and nothing in life is 100%. So, we don't want to think we do all these things and then someone still is positive. There's always potential for other things, but these are shown to definitely help us decrease our risk. And the big one is keeping distance. So at least 2 meters away. Remember I said those droplets are heavy and they tend to fall down in front. So it's not like they stay in the air like some other viruses do and bacteria. The other key is if you can't keep 2 meters apart, then to wear a community mask. And we'll talk a little bit more about community masks in a minute. And the other big thing to prevent all viruses and bacteria is cleaning your hands. Remember I said it can last up to 15 minutes on our hands, and we all do that, put our hands to our face. So if your hands are visibly dirty, then you should wash them with soap and water. If not, certainly hand sanitizer is a good alternative to that. And we'll have lots of non-alcohol based hand sanitizer that's been approved by Health Canada in schools. So they'll be all over the schools. Each class will have their own dispenser for it under the supervision of the teacher, obviously. In all the common areas of schools and the entrances, so there shouldn't be any reason why people don't have access to the hand sanitizer. So that's just an example about staying apart. So we've seen lots of things about hand washing, and there's steps to wash it. To wet your hands first rather than putting soap on first is one of the important points, because you want that soap to be nice and slippery to help, because it's the rubbing your hands together vigorously that helps to get rid of that virus so it goes down the drain, and to make sure that you get the backs of your hands, your fingers, your thumbs all over. And it takes about 20 seconds for that. And then to rinse well to get all that soap off, and because that's where the virus will go down the drain, and to dry with paper towel. And if it's not a touchless tap, then you can use that paper towel to turn the tap off so you're not touching the tap that you had just touched to turn it on. So as I said, when your hands aren't visibly dirty, then you could use hand sanitizer. And so you just need a small amount, like just around a dime size or less. I know the stuff that they have at school is like a foaming one, and it actually rubs in quite nicely and dries fairly quickly. And because some of them, if you get too much on, then your hands are quite wet for a little while, and you still need to rub them together until that dries off. So the same idea is to rub your palms of your hands together to get the backs of your hands in between your fingers, your nail beds, and your thumbs to get all the surfaces of your hands clean of the virus. And it'll help with other viruses too. So we hope to see a decrease in the amount of flu and colds and all those kinds of things that we usually see in the winter months. So a community mask, and we've seen lots of those around. There's lots of interesting fabric out there. I actually have one with me today, and it says "Be kind, be happy" on it with little beehive nests and little bees on it. So those should cover your nose and mouth. We see many people, not many, but lots, that you see people with it like that. And that's not, because then you still have your nose out, so there's still parts of the virus that can get out there and get on things if you happen to be positive and not know it, because we know that one of the things we found out with COVID-19 is a lot of people can be positive for it but not have any symptoms. So when they say asymptomatic, that's what they mean, that the people haven't been showing any symptoms, but they test positive for it. It should have 2 layers of tightly woven fabric so that, you know, if you did cough or sneeze or anything, that it wouldn't come out through the fabric. And obviously, if it gets wet or dirty, then we would want to change it and have a different one and then wash that one. If when we put our masks on, we should hand sanitize or wash our hands first, then put it on. And then when we take it off, same thing, we want to hand sanitize after. There is a little video that I'm not sure, I can see if it'll go out to it, maybe. So it won't go large. Oh, sorry about that. Okay. We'll skip that part. Okay, I will show you. So I've washed my hands. You put your mask on, make sure it's under your chin and up over your nose, and hold it by the little elastic, or the elastics or the ties. And then you should adjust it, just hold on to the top and the bottom to adjust it. And if it has a metal piece, which it's nice if it does, because I have glasses and they tend to fog up, but with this one, it does go quite tight, and I found that they don't fog up with that. So the idea is to keep your hands away from all the fabric in the front. And so then when I take it off, same kind of thing, you just grab it by the ear ties and then pull it off like that. And you want to put it in a bag, preferably a paper bag or a plastic bag for use at a later time. And then I would I'm in here by myself, so it's okay. I would hand sanitize after I take it off.
How often now should we wash the masks, or especially students? How often, like daily when they come back from school, or what do you recommend?
I would recommend daily for students because they've probably had it on a fair number of times during that day. And, you know, it's been in their backpack and all around. So it would be good to have a few masks available. And I would suggest that, you know, you have they would have 2 in their backpack. So then if one gets wet or dirty or anything, then they would have a backup for that. Schools will have limited number of masks available for people that forget them, or, you know, if one got wet or dirty or anything like that, but they don't have a huge supply of them.
That's good to know. Thank you.
So just another one of our Mythbuster things is about, we've seen people with face shields, which are great. They help protect us some, but it all depends on how large those face shields are, how far they come down. They really need to come down quite far and go around to the back, which most of the ones you see do not do that. So we highly recommend that you wear a mask if you're wearing a face shield. So I know that some of you may have been in restaurants or places where people have had face shields on only, but they tend to ride up, and then, you know, if they sneezed or cough, the virus could come down and they could get on you or get on the surface. So we do recommend, there are going to be some exceptions to that, but those would be quite limited of the exceptions. So about cough and sneeze etiquette, that goes back to even before COVID, about, you know, you want to make sure, we always say cover your mouth or your nose when you sneeze, but the best way is to do that into the crux of your elbow or on your sleeve so that it's not on your hands, because then your hands touch things and that can spread the germs that way. Certainly you could use a tissue if you have one of those available. I always joke and say, make sure you have a tissue in your pocket, and then it gets in the wash, and then that's a pain for whoever's doing the laundry, right? So, but it's important then to have somewhere to put that used tissue as well as in the garbage. So after you cough or sneeze or anything like that, then you should use hand sanitizer then. Or if you have soap and water to wash, that's great too. Some of our classrooms in the schools do have sinks in the room. Not all schools, but some do. So one of the things that we want people to do before they leave for school every day is to ask their child how they're feeling. Basically, that's what it comes down to. Are you feeling well today? And kids are usually pretty good at telling you how they feel, right? If they have a tummy ache or their head hurts or they're coughing or sneezing, you see that. So it's important to be mindful of that before they go off to school. So if they have 2 or more of the symptoms, you can see the little pictures there, a fever above 38, a new cough, or one, you know, maybe they always have a bit of a cough, but now it sounds a lot worse. Are they having a hard time to breathe? Do they have a runny nose? Are they complaining their throat hurts? Do they have a headache? Are they really tired more than what normal, you know, normally it's hard to wake them up in the morning and get them moving. They're not a morning person, then that's probably not a problem for them. But if normally they're up and bright and ready to go and they're really tired and they have another symptom, then that could be an area of concern. Are they complaining their muscles hurt all over? Do they have diarrhea, like really loose stools that, you know, and it's not because of something they ate, that too much sugar or whatever, but they say they can't taste the type of food that they have, or they can't smell. Or for children, they've found that there's purple markings on their fingers, that their toes have been one of the concerning symptoms. So any 2 of those together, then you should keep the child home and call telecare, or if you have a family doctor that you can call, or you're followed by a nurse practitioner, then you can call them for advice. You can also look on the GMB website, and the address is there, or if you just type in COVID-19 GNB, it will bring you up to that. And there is a self-assessment questions on there as well, and it'll tell you what to do.
Well, I have a question. There was a question actually sent earlier in the chat that is, I think it's related to the screen that you have now, and it is, I'm sure it's in the back of my minds of every parent. She's saying, hi, a question that occurs in any workplace, I believe. What if my kid wakes up with a headache or a running nose? They usually might have took a pill and went to school. I believe for the safety of the others, they should better stay home, yet not sure about the absences. So it is going to be a common question. Like, we all know the kids, you know, they are going to catch viruses and they're going to feel down where the weather is changing. Their nose might feel stuffy, or it could be just simple things like just being a human. How do you assess that? Like, they're going to keep being absent from school? Like, what do you think? Like, I'm sure you guys address that issue. Can you elaborate?
I would be tempted to get my child, wake them up earlier than I would have in the past, just to give them a chance to get up, to eat their breakfast, to see how they're feeling. Because, you know, sometimes you wake up with a stuffy nose and your throat hurts a little bit, and then you know,
then
wash
you're
your
fine.
teeth and eat, and then they feel fine. So that would be one thing for that. Parents know their children the best. So, you know, if this is something new for them, then I would keep them home. If it's something that they typically have in September, October, that they have a runny nose, then, you know, that would be, you know, if they've seen a healthcare provider about allergies or anything like that, then they wouldn't need to stay home. But maybe Dr. Barker has some other thoughts that she wants to share.
Yeah, so maybe, Anne, you could talk a little bit about distance learning options.
Yeah, so there are plans for if children need to stay home for any extended period of time, then there will be opportunities. They have software called Teams, and teachers will be using that at different times. In high school, they will be using it regularly. So we know that we have dropped the enrollment in high school every day by half. So say like at Saint John High, they will be down to a little under 500 students. So the other half of those students are still considered to be in school that day. So they'll need to sign on to their teams and be involved in that class, because they're not going to teach the same thing 2 days in a row. They would be continuing on with that teaching. So you're still considered to be in school. Now for the younger students, it will depend on when those children are out, and it's good for parents and the students to get used to using Teams. And so assignments would be posted on there, and any links that they use or any assignments would be on there. So it's really good to get used to that in case, you know, that they need to use it a lot more, or maybe that there is a reason that they're on 2 weeks of isolation, and that would be used then as well. There are opportunities for students that maybe they're immunocompromised, so their immune system is low and they're not, you know, it's not recommended that they attend school, or maybe they have some other health issue that would keep them from going to school. So arrangements will be made for them as well to have online learning. Okay. And it's important for the schools to know those things about your child. The sooner the better. Like if anyone this week, you would get in touch with your school principal. Past, if you've been involved with the education support services and you have a contact there, it would be important to contact them. And be in contact if you have a healthcare provider, so a family doctor or nurse practitioner, to get their advice about what to do about returning to school.
Yeah, no, that's really good to know. So then, generally speaking, you know, if I know my kid usually around September when they first go back to school and the weather changes, they have just runny nose, it's okay to go unless the symptoms get worsen or changes, or like that's acceptable.
Yeah. And I would say if they have signs, you know, they have chills and they're complaining that and you think they have a fever, that's always a point for them to stay home, even if they just have that fever. Because that's just a sign there's something going on. We're not sure what it is, but they should stay home with that.
But generally speaking, like being absent from school for any of these health reasons, as long as the parent, I guess, contact the school to say my child is home because, because of that, it's the children are not going to be penalized, kind of.
No,
thing, like,
no, they won't be penalized.
Okay. Thank you. I hope that answers the question of and if someone also is still concerned or have any questions, just feel free to join.
And so to outbreak management. So what is an outbreak? Before I came to public health, I thought, oh, you need at least a few cases to be an outbreak, but it just depends on what the type of virus or bacteria is. So for COVID-19, it's defined as one positive case could be an outbreak, and that depends, is it in the classroom, the whole school, or the whole community? And that's what public health will do. We'll look at that and determine what the risks are and then decide who needs to stay home and for how long, all those kinds of things. So it is under the direction of the Regional Medical Officer of Health, and that's Dr. Barker in our area. And so she would contact the school or the school district if there's a positive case is confirmed. And, through all this, we keep as much confidentiality as we can. So it doesn't mean that a school is going to say that Ann Hogan is positive for COVID-19 and she is in Miss Barker's class at school. So the school will know that there's a case at the school, so the parents could be informed of that, but it'll be all under the direction of public health, and we'll provide, what information is supposed to be shared, but it will come through the principal, the medical officer of health, and our superintendent, Zoe Watson. And Zoe Watson has been very involved in the planning for all these things. So as I said, public health through contact, we hear a lot about contact tracing, and that's why it's so important for people to, the schools to keep a log of any visitors, keep an attendance of students and staff, of maintenance people, custodians, anybody that's in a school. We want to know, not because we're checking up on everybody necessarily, but we need to know for public health in case a case is identified, then we would determine who potentially was a close contact of that person and would need to self-isolate, and maybe who wasn't, or maybe that child wasn't at school that day, or there's lots of factors that come into play with that. It sounds easy when we say the two words contact tracing, but it's much more complicated than that.
So if that has been confirmed, and then what will happen? Like the whole class with the teacher is going to be self-isolating for 14 days, or?
It all depends on the interviews that public health does and the determining how close the contact. Close contacts considered closer than 2 meters for 15 minutes or more. So that's why you can see how just the interview with the people involved will determine who has to stay home and who doesn't. And we'll have the principal will provide public health with the records of anybody that's been in the building and in the class and all those different things.
Thank you.
And also on the other end, public health will let people know when they can return to school. And there is a link, if the people go to the presentation, there is a link for the guide from the Department of Education, so that would take you. So there's a couple of different ones. There's a big guide that was released on August the 14th that's 65 pages long that includes everything. There's another one that was released on August the 13th, which is just quite a bit smaller than the 65-page one, and it was a guide for parents and public, and it's about 16 pages long. There's also a 2-pager that kind of summarizes more things. And then this PowerPoint, the helps to summarize it a bit more. So taking the bus to school. So if your child takes the bus to school, they should stay 2 meters apart at the bus stop with anyone that's doesn't live in the same house as they do, or potentially, I guess, at the bus stop, you know, if we were in the same class, then potentially you could be closer at the bus stop. But the more we keep that 2 meters apart, the better, to decrease spreading of any potential virus. As I said, it'll help with cold and flu and all those things as well. So on the bus, we're recommending that students in kindergarten to grade 12 wear a mask while they're getting on the bus and getting off the bus. And they'll have assigned seating on the bus, because if there's an identified case from that bus, it doesn't necessarily mean that all those students would have to self-isolate. It'll just depend on how close they are to that person that was positive on the bus. So we'll be, you know, asking the bus driver then about where the children were sitting on the bus. In children in kindergarten to grade 5, it'll be 1 child per seat or 2 from the same home. So if they live in the same house, then they can sit together on the bus. Otherwise, it'll be 1 per seat. And in grades 6 to 12, they're required to wear a mask if not sitting with someone from the same household. So if they were sitting alone, or they're sitting with their brother or sister, then they don't need a mask on while they're on the bus. But otherwise, they do.
So there will be a bus for every student, or you're gonna prefer if parents would drive their own kids if they can?
So it's up to each individual family, the commitment that they can make to driving their child to school and picking them up, that certainly. But, you know, the district is supplying transportation, and there is a website for that, for Bus Planner, and you can go on and find out, you know, the bus number and the route and what time you're picked up. And some of the times maybe a little bit earlier this year. And there may be a few that maybe took the bus before, but may not be able to get the bus this time. But it's best to look on Bus Planner and see about that. I believe it's if you live further than 1.5 kilometers, then you can get a bus. Important, really, really important is next week. It's bad most years, but it'll be worse this year with the amount of traffic, as you said, about people driving their children to school. So we'll have buses. We have more people dropping their children off. So it's really important to watch for cars. We don't want anybody getting struck by a car. Not all of our areas have sidewalks. So remind them to walk on the left-hand side facing traffic, to make sure they cross at appropriate crosswalks. A lot of the communities are responsible for crossing guards. So it's important that, you know, that your child goes to where the crossing guard is, if there's those in your area, and just be very aware of the cars, because there's going to be a lot of traffic come Tuesday morning next week for sure. Driving to school, same kind of thing. Remember, there's going to be lots of traffic. Are you going to be late for work that day? I bet a lot of people are going to be late from work that day. I know where I live, almost every way out, there's a school. So I'm trying to think, I'm going to have to leave quite early that morning in order to get to school. If you do drive other children in the neighborhood to school, then it's best if those kids are in the bubble from school, and just to keep track of the kids that the person drives to school. So if you offer to drive your friend's child to school, just remember that, you know, you should write down the days that you drove that child to school. So at school, your child will be directed on where to go. There'll be signage, there'll be teachers in the school grounds. And they'll get orientation. I know most schools have a staggered start, so they'll only be bringing back certain grade levels on the days for the first few days. So it's important also on the other side that if, you know, parents depend on childcare, that during that first week of school, the child may not be in school every day that week. Most likely they won't be, because it will be staggered. So you'll need to make some alternate plans for childcare that week. And for, you know, any time during the year, you'll need that kind of emergency plan of what you're going to do if you get a call from the school that your child has a couple of symptoms and that they need to go home. Also included in the directions for the kids, so they'll get a full orientation of what's expected to them and how to get into the school, how to move around in the school, how to get out of the school. So the differences in our elementary schools this year will, in kindergarten to grade 2, they'll keep the groupings, the classes, the bubbles, whatever you want to call them, to 15 students as much as possible. And in grade 3 to 5, it'll be 22. And in middle school, they haven't changed the size. The big difference in middle schools as the teachers will move rather than the students. So the students will stay in their bubble through the whole day. And it's the teachers, and when the teachers change classes, they are encouraged to keep that 2-meter distance, or they have access to plexiglass. So if they were going to help one of your children, child could get closer, but there'd be plexiglass between them. And if that doesn't, if that's not possible, then both the student and this teacher could wear a mask. And remember that, you know, it's up to, when we wear a mask, we protect other people, and when they wear a mask, they protect us. So we're all in this together for sure. And we did talk a little bit about the blended learning in grades 9 to 12.
And it's Lynn. Can I just interrupt for a second?
Hi, Lynn.
Hi. With regard to the grades 9 to 12 students.
Sure.
We have some of our newcomer students who will be going to school every day at high school.
Perfect.
And those students are being identified as we speak, and the schools will be in contact with the parents as to who those students are. And the reason for that is because if we have students with very low levels of English, it's important for them to be at school every day. And so they will be identified, and the schools will be in touch with the parents, and or I will be supporting the settlement agencies to get the messages out to these families. So I just wanted to throw that in.
Oh, that's great. Yeah. That's perfect. And also there'll be some adjustments made for families who live in areas where maybe their internet access isn't that great, or that they don't have the technology that they need right now. I know that schools are looking at some alternative places for them to do that as well.
Okay, excuse me. I have a question. Yeah. If some kids get like a positive test of COVID-19, and after treatment and after their, are they allowed to get back to school or not?
Are they allowed to go back to school after they've been tested positive?
Yeah. After their treatment.
Oh, yes, they will. That actually, Dr. Barker would make that decision on when they would be able to go back to school. I mean, typically it's 14 days, but it could be a little more. It wouldn't be less than 14 days, but it could be a little bit more than that. But Dr. Barker might want to say some more.
Yeah, I think it's important to clarify that unfortunately at this time there is no treatment. So really what we do is we help keep the children or the parent or the teacher home for 14 days, because our knowledge so far is that after 14 days, they are no longer infectious to others.
Okay, thank you so much.
And the 14 days can be determined from when they get tested, or it could be determined from when they start to get symptoms. So it could be a little difference in that, calculating the 14 days. So who's allowed to enter a school? So that's a little different this year. That might be a little more anxiety for parents, I guess, because in you know, I have 3 children that are out of school now, but I know it was always good when you could go in and volunteer, or, you know, kids might forget something. So we'll talk about that a little bit. Obviously, students are allowed in the school, and school personnel, including, you know, teachers, so they could be visiting teachers that are resource, or that they guidance that move from school to school, or they could be supply teachers that come in, and other supply staff that, and other people that travel between schools, some of the child and youth team, all those different people that are within our schools. And other essential services as approved by the principal. So that could be social workers, public health nurses going in to do the immunization clinics, or myself as a healthy learner nurse. You know, before, most times I would have, you know, mention that I was coming, but sometimes I wouldn't. But now certainly you would all need to make sure that it's okay to go into the school. Work safe MB officers, volunteers. And we're really going to limit the number of volunteers at the beginning of the year until schools get settled and see how things go, and then gradually work with the volunteers, because they certainly are very valuable to our schools and we really appreciate them. It's just that we want to limit the number of people in the school, and then for everyone to get used to kind of all the different things that they need to do this year, and then we'll see the number of the volunteers. So that'll be revisited in early October.
How about the extracurricular activities? I don't know, are you going to be talking about that, or?
Yeah, a little bit, yeah. So any drop-in or unplanned visits by parents or guardians are limited and not really encouraged. Appointment is preferred. And maybe some of those visits could be done on the phone, or done through things like Zoom or Teams or those kinds of things, to limit the number, just to increase the distance between people, the physical distance. And as I mentioned about the school operational plan, that'll be available on your school's website on September the 3rd. And it will be reviewed at least once a month and be signed by principals. So schools that have joint health and safety committees, which I think is schools that have a staff of over 20, I believe it is. But they all need the operational plan, but some have a joint health and safety committee, so that committee would review and make any changes that are necessary for that. And so then there is a log sheet to see that you can look on and see what was changed for that month, rather than having to go through the whole document wondering what was changed. They'll list that as well. And if you have any questions about the plan, then to contact the school principal for that. We talked a little bit about this already, about vulnerable students. So families should discuss with their health care provider to determine whether the child should, remember, physically attend school, and if they're unable to, then other arrangements will be made to learn virtually. And that could affect some other household members as well. And sometimes the siblings of those students may need to learn virtually as well. So what happens if your child feels sick at school? Well, the first thing they should do is tell their teacher or another adult that how they're feeling. So they may say, I have a headache and, you know, my throat hurts. So then they'll be taken to an isolation space. It might be a room, it might be an area. It would be an area that they would be 2 meters away from others. They would be asked to wear a medical mask at that time. And the school will call the child's parent or emergency contact. So it's really, really important that the information that you give to the school is up-to-date information. Because if there's a wrong phone number, or you change your phone number or anything, then it will be difficult for the school to get a hold of you. And what we're asking is that your child be picked up within an hour of getting that phone call. So you can see where it's really important to have a backup plan for be unexpected times that your child might need to be picked up. And it's even more important to make sure you ask them before they leave to school how they're feeling, right? So if someone who lives in your house gets tested, then this one is kind of, it depends. One's a little harder to answer. They may need to stay home and self-isolate until the results. The person who gets tested definitely needs to stay home and self-isolate, so not go out and have limited contact with the people that they live with. So if they're over 16 years of age and have an MB Medicare card number, they'll be given directions on how to get those results online. Right now, for anyone less than 16 years old or over 16 years old who don't have a Medicare number, then public health will call with the results. So once again, it's important to have a working telephone number that public health can reach you at to give you those results. That's being worked on a bit more. So hopefully in the near future, you'll hear that you will, if your child gets tested, then you'll be able to go on and see their results. Certainly if there's a positive case in our area today, then Dr. Barker would be notified pretty much immediately. The goal is within an hour that she would be aware of that, and then we would start to work on the contact tracing with that. And public health would, tell them about self-isolation and go over all of the things that go with self-isolation. So if the results are negative, then we want the people to stay home until their symptoms are gone or your healthcare provider says it's okay to return to school or work. If you have a fever, then they must be fever-free for 24 hours, and that's without taking any medications for the fever. So, without taking acetaminophen or ibuprofen, then it would be the 24 hours for that. Certainly, it's a time of stress and anxiety for lots of people and worry. I would say try to limit your time spent on watching news and all those things, because or listening to the news, there's lots of things on all the time, and not having a lot of population in a small area. But it's really important for parents and caregivers to feel confident in the information that they have around COVID-19 so that they can support their children. Because if you're anxious, then that, goes over to your children as well. And certainly reaching out for help is not a sign of weakness. And it is a sign of strength that you recognize that in yourself and that you need some help with this and how to talk to your children.
And I just want to add, I just want to add something like might be useful to some people, just to confirm, like with the Kids Help phone, I see here, there is a line just in Arabic. We have advertised about it. If you guys need any more information, let us know. And for the NB health card, basically the province confirmed, and correct me if I'm wrong, if someone does not have a valid health card for whatever reason, and if they have any COVID-related symptoms, they still can seek help, and they're not going to be charged if it's COVID-related.
Right. No, that's correct. It's just the thing I was talking about was getting the results, but definitely people
just to confirm,
encouraged about getting tested. Yes, don't not get tested because you don't have a Medicare card. It's important to still get tested for sure.
Awesome. Thank you.
Yeah. And once you call, if you go through 811 to arrange for testing, they will call you back with an appointment and exactly where to go and what the directions are around getting tested. So there's just some other, and the Kids Help Phone is a good resource for sure. And certainly with school starting, your school guidance counselors, the child and youth team are all good resources for that. And in general, the schools will be talking about, you know, your mental health, mental fitness at schools and doing things to help children with that and encouraging them to speak up if they're feeling anxious or concerned. So there's just contact information if they have any other questions. Now that schools are open, the best number to call would be your school rather than the general line at district office, depending on what kind of question you had. But the best start is with your school for sure. And then the Anglophone South School District website, and those are just links that will take you direct to those reports and to the Government of New Brunswick COVID-19 website. And certainly if anyone follows on Twitter or Facebook, the district has updates on those. There's actually our communication person, Jessica Hanlon, has made a cute video, an animated video for young children around mask use and transportation. So those could be helpful in your discussion. I would encourage people to have the conversation with your children about the changes and, you know, practice wearing masks and ask them how they're feeling and what can be done, what's going to change and what kind of stays the same. So thanks a lot, everyone.
Thank you so much. I have a question here from Alexandra. She says, hi, thank you for the very useful information. I have a question. Is the use of antibacterial wipes recommended? The ones that they kill 99.9% of bacteria? Thank you.
For at home, you mean?
I guess
is that what you mean, Lavender?
I think you mean at school, Alexandra, right? Or home, or both?
Both. Yeah. So at school, they use an approved product. It's called 362. And all the schools, that's the product that they've used for cleaning for a long time. And that it's Health Canada approved. Certainly for wipes, you can use those at home. One of the issues at school with wipes is just the scent of them. We do have people that are scent sensitive. So schools always try and find products that have a low scent to them so it doesn't bother those people, because some people get migraine headaches or it causes them to have difficulty breathing, those kinds of things.
Yeah. Well, thank you. I was, that is very, very helpful. I was thinking of the wipes, kind of something like this, as an alternative to the gel, say, for example, at the bus stop. Because this would be much easier. Yeah, for the hands.
Oh, okay. Some of them are quite harsh for your hands. So it probably would be better for the gel unless they're specifically made as hand wipes.
Yes.
Yeah.
And so the one thing that we are quite confident is that the Lysol wipes do not work. So against COVID. So if you're using the Lysol wipes for hands, that's not sufficient because there isn't sufficient alcohol percentage in the wipe itself.
Oh, that is interesting. Yeah, well, the ones I bought basically are just, like wipes for hand wipes. And they are like 99.9%. They kill 99.9% of bacteria. So I think that they are very, very handy, easier to use than gel, especially if kids are traveling or at the bus stop. So I was wondering whether this would be kind of a good alternative to the hand sanitizers.
I think it goes back to what I said too about the friction of rubbing your hands together, and that's what kind of helps to get rid of the virus as well.
Ravi, okay.
I think what I would suggest, Lena, is that I will send a link to you that you can add to this presentation so that people can know where to go to visit Health Canada on their link that describes all of the products that are useful against COVID-19. And if the product isn't on that list, then it's probably best to not use it.
Thank you.
Good
That's
idea.
awesome.
We could get them to add that to the Anglophone South website too.
Yeah, thank you so much.
Thank you.
And I
Thank you.
have a question that was emailed to me earlier from a parent. What if a parent feels unsafe to send their kids to school? Whether they feel unsafe like now, kind of thing, they just, the whole idea, or after they send their kids to school and they feel that the school maybe or the whole system is not really working for them and they don't feel that their kids is safe. What would happen? Do you have any idea, or that's not a question for you guys?
Anne, can you start?
Well, there does, besides anxiety, I guess, of parents, then I think that to start with, they should approach the principal to review the plan and the areas of concern. Because certainly we look at decreasing the risk. And right now in our area, it's low risk of the virus because we don't have any community-based cases or anything. Certainly it would be looked at on a case-by-case basis, but in the K to 8 range, it wouldn't be a reason to keep your child home, or, you know, there are options. The other option is homeschooling, but that would be that person following the curriculum and teaching their child themselves.
Thank you so much. It is a tough one. Like the common question for people really, are our children safe? Even for teachers, because you know, some parents also are worried, like, are teachers gonna feel free to just, if they're not feeling well, or if there is any symptoms, to stay home? And if that's the case, then what's, you know, the education level? Is the teacher gonna be able to teach from her home if she cannot be physically at school, like we're doing today? Like, for example, I work 1 week at work and 1 week from home, so I'm home today, but I'm working. Because they're worried about the education level of the children. And supply teacher is gonna just keep coming and filling in the gaps. Do you have any idea about the, you know, what's gonna happen with teachers? Will they be teaching from their homes if have to?
Depends. If it was the whole class that was on self-isolation, then the teacher would be expected to teach on Teams from home. And that's why the teachers have all been encouraged to get the children used to using Teams at school. And so then if this does happen, then they'll be used to going on at home as well.
Okay, so that is a possibility then.
It could be, yeah.
Yeah.
Definitely a possibility if it's, you know, like the whole class. And I would be surprised right now if it was the teacher at home and the children were at school, because they still need to be supervised at school, right? So
yeah, true, because some group of kids, they are going to be in school for sure.
Yeah,
at some point. Yeah, no, you're right.
There's some of those things to consider.
Unless you said, like, the whole class, they're going to be, you know, isolating for 14 days, then yeah, maybe.
Yeah.
How about sports?
Then if the teacher was, you know, not unwell, then they would be expected to teach.
Yeah.
It's my understanding of it.
Okay. And how about sports and extracurricular?
Oh yes, sorry.
How's that going to look like?
So I will say that the majority of schools' operational plan, so it needs to be in their operational plan. The majority of schools are not having sport teams. They obviously will have physical education class, that's part of the curriculum, and that would be in their K-8, that would be in their bubbles. And in 9 to 12, there's some things around that about 1 meter apart, and you know, wearing masks if they can, physically distance, and those kinds of things. As far as the interscholastic sports, so say if, you know, my child played soccer for KVHS, and that there's a whole appendix in the return to school document about that. And right now, some of those teams can practice skills by keeping physical distance. And they're going to revisit that later in September as to whether they would have inter-school play. It'll all depend on what we would call the epidemiology of COVID-19 and how many cases are around and what's the risk level of that. But schools may choose not to participate. And for other activities within the school, they will, you know, try, and that's the best part about going to school really, is those fun times of having different clubs and things. The physical distancing and masks and the hand washing and hand sanitizing will all apply to those. And some may choose to do them virtually. Some may do them, you know, have their bubbles, and then they could be virtually with another bubble. I'm sure there's lots of different ways that they're going to continue with those things. Yeah. And for assemblies, they, most of those will be done virtually, or some have plans to go outside, or some have plans to, I think at Saint John High, they plan to bring groups of 50 or less into the auditorium and then have them physically distance in there. They have a huge auditorium there. So it'll just depend on, that's why I say that's the kind of thing that's in the operational plan that varies a bit from school to school.
Yeah, makes sense. Yeah, no, thank you so much. Does anyone have any other questions for Anne or Dr. Kim? I don't have anything in the chat, I guess. Do you have anything at the end you want to add, Anne or Dr. Kim, toward the end?
I would like to add that I'm so grateful that, Lena, you've taken this so seriously to make sure that all of your families have the opportunity to understand the importance of trusting the plans that are in place at the moment and returning to school next week. The other thing that I would like to commit to, Lena, is that if we were to get a school case or outbreak, that I think it would be important that you and I be available to do a similar Zoom call, and perhaps with a variety of different translators depending on the family's language of choice, because I think it would be really important that we communicate effectively around the do's and the don'ts.
Definitely, we definitely should, absolutely. I really hope we don't ever have that, but reality is we might, and that is okay, because we're trying to just spread education. It's not about fear or anything like that. We're trying to be proactive in the community, and I can't thank you enough, both Dr. Kim and it's really extremely valuable. And we definitely, when that happens, most likely you will know before I do as a public. Please let me know. And having different languages will be extremely valuable. I can definitely manage to do that in a very short period of time. Within a couple of days, I can get lots of other languages that people like to translate and all that. So we'll make it happen.
I know if anyone's, you know, in the future involved, whether they're a case themselves of COVID-19 positive, or if they're, you know, a close contact, we do have access to language line. So through the phone, we would use that for anyone that's not comfortable using English. So, and I know through stressful times, that's even more important for people to be able to speak in their own language, for sure.
Absolutely.
So that's another option that's available for people.
That's really good to know. And if you have any connections or any links, please share them with me, and I'll share them with the parents. For sure.
I know Toronto Public Health has their self-isolation, hand washing, hand sanitizing, all those things translated into many, many different languages.
Yeah, and I know like Len McDonald always sends lots of information and like different awareness like messages in different languages as well, and we've been sharing them. And I know the school itself, that each school has been sharing them as well with their students and the parents. But yeah, we'll keep spread, you know, sending the message and spreading the awareness. Really, it's very, very important.
Thank you so much.
Thank you.
Thanks a lot for the opportunity.
Thank you. Thank you so much for your time. Really, really appreciate it. Thank you.
Thank you.
Have a wonderful day, and thank you so much, everybody, for watching. If you have any other questions, just send them to me, email them to myself, and I will share them with Anne and Dr. Kim, and we will get you the answers. But have a wonderful day, and stay safe.
Thank you. Thanks.